This is a beginning of a series, and we'll be talking about traumatic brain injury. So we'll be looking at the following journals, which is the Lancet Neurology, Moderate and Severe Traumatic Brain Injury in Adults. And secondly, we'll be looking at the New England Journal of Medicine, which is Traumatic Brain Injury, Football Warfare, and Long-Term Effects. So this will be a brief overview of what is entailed in traumatic brain injury. So to begin with, traumatic brain injury is any brain damage that results from external forces onto the brain. And it can be caused by a penetrating object like a bullet. It can be caused by blast waves, for example, a bomb blast. And it can be caused by road accidents, and there is a rapid acceleration and deceleration of the head, which results in the tearing of the axons in the brain. So traumatic brain injury is important because of the statistics that go with it. Over the past few years, the number of traumatic brain injuries have been increasing, and this is because of there's more motorized people in developing worlds are getting more cars, and there are more accidents, so they're getting more traumatic brain injuries. Also, in developed countries, there are more aging population. So the people who are aging, there are more chances of getting falls, and because of these falls, the numbers of traumatic brain injuries are increasing. So there's also a special entity in traumatic brain injuries, which is the blast injuries. And these are caused, of course, because of the increasing wars and terrorist activities. And this has led to blast injuries being a special entity because they have a different pathology compared to the other traumatic brain injuries. Let's look at how traumatic brain injuries are classified. Traumatic brain injuries can be classified depending on the mechanism that happens. For example, if the brain injury penetrates the brain, then it's called a penetrating brain injury. However, if it's a blunt object and the object does not penetrate into the brain, then it's a closed brain injury. So based on this, you can classify the traumatic brain injuries on the mechanism that happens during the injury. Also, there's a Glasgow Coma Scale, which has been accepted by physicians as the universal system of classifying traumatic brain injuries. The Glasgow Coma Scale is used to classify the traumatic brain injuries into three. It can be mild, moderate, or severe. And this is based on three receptors: the eyes, the motor, and the verbal scale. So basically, the physicians will check the response of the person in terms of the verbal response or the motor response to pain, and based on this, they can classify how severe the injury is. So another different method of classifying traumatic brain injuries is based on the structural damage that occurs. When there is a traumatic brain injury and the physicians do a CT scan, they can check from the CT scan and see how much swelling there is, and from this they can check the lesions and check whether there is a midline shift in the brain. So based on this, you can classify and know how severe the injury is. Traumatic brain injury basically has two main stages after it occurs, and you can classify this on the primary damage and the secondary damage. The primary damage is the damage that occurs directly after the injury, the impact to the brain. So in the primary damage, there's it happens maybe a few hours or a few days after the injury, and what happens is that on a macroscopic level, there's the formation of hematomas, which is basically blood accumulating somewhere inside the brain. There is a focal contusions, or there can be swelling. In the cellular level, the axons are disrupted, and because of this, the ions, the leaky ion channels. So on the cellular level, there's the leaky ion channels, and also there's the transformation of the proteins, which is proteostasis. Secondary damage occurs after the primary damage, and it's usually different pathophysiological mechanisms occurring at the same place. Basically, there is the release of glutamate, which is also known as excitotoxicity, and the release of glutamate is linked to calcium because it leads to the calcium entering into the cell, and when calcium enters into the cell, it can lead to the mitochondria becoming, and when the mitochondria has a dysfunction, then this leads to the loss of energy in the of the cell, so it doesn't produce ATP, and this eventually can lead to necrosis of the cell. So in this slide, we can see the different ways in which the traumatic brain injury occurs, and they're all related to each other in that a hematoma can occur with a contusion at the same time, or a diffuse axonal injury can occur with the hematoma. A diffuse axonal injury, briefly, is, for example, when you have a bunch of flowers and you shake them, and once you shake them, then they break in the middle. So basically, diffuse axonal injuries mainly occur in motor vehicle accidents, and they occur when the brain shakes against the skull. So it causes the shearing of the axons in the brain. So all these are related to each other, and eventually, when you have a contusion or a hematoma, it leads to the swelling of the brain, which increases the intracranial pressure. It decreases the blood cerebral perfusion. So that you can see this on the left part of the slide, while on the right part of the slide, they talk about the different mechanisms, for example, inflammation or secondary damage, which occurs, which leads to more secondary damage in which kind of injury. So as you can see, for example, in the diffuse axonal injury, the culture-mediated damage accounts for most of the secondary damage that occurs in this kind of diffuse axonal injury. In traumatic brain injuries, there are various outcomes depending on the injury that occurred. It can be a mild injury or it can be a severe injury. And in the middle of that, there are those who get mild repetitive traumatic brain injuries, for example, boxers or wrestlers. So if during a mild traumatic brain injury, there can be a contusion or a loss of consciousness for a few hours. In the mild repetitive traumatic brain injury and the severe traumatic brain injury, there are various different kind of proteins are released or activated, and this causes a different pathology in both mechanisms. So taking, for example, the mild repetitive traumatic brain injury, it causes the release of the tau proteins, and these tau proteins form neurofibrillary tangles in the neocortex. So this is a basic pathology of repetitive mild traumatic brain injury. So when this occurs, it leads to a syndrome later, which is a neurodegenerative disease, which is dementia pugilistica, also known as punch-drunk syndrome. The current management therapies for brain injury basically aim to reduce the intracranial pressure and to increase blood flow, yes, blood perfusion. As you have seen, the major therapies mainly work to reduce the symptoms that are already happening. However, the physicians and the researchers are also looking at ways of neuroprotection, that is, to stop the secondary events from occurring. And however, this has not been so effective. So far, most of the drugs have not been able to treat this secondary events. So the main problem here is because there is not much validity of the results that occur in the research and the results that can be translated to the clinic. So the pathologies, most researchers focus on specific pathologies in the traumatic brain injury, and while focusing on some, they leave out the rest, leading to an overall ineffectiveness of the drugs. So the research focus right now is basically shifting from trying to target a specific pathology, for example, glutamate, to actually letting the secondary damage occur and now just trying to replace the cells or focusing on regeneration of the axons and neurons again. So in conclusion, traumatic brain injury is the direct impact of onto the brain, and it can be classified, it's universally classified by the Glasgow-Coma scale. However, this current classification leaves out a lot of patients because the traumatic brain injuries are very diverse. So what is required is to find biomarkers for each patient so that there is more personalized care for each patient and better outcome, functional outcome for all the patients. And in the research field, the research has shifted to focusing on therapy based on targeting more pathological processes than just one. And the research has also changed into focusing on the neuronal regeneration.